So good afternoon, everyone. Thank you so much for joining us. We're happy to have you here today. My name is Kayla Rogers, and I'm an Education and Outreach Coordinator for the Women's Fund. For those of you who are not familiar with the Women's Fund, we are a not-for-profit organization in Houston, Texas, and our mission is to provide women and girls with the tools they need to be advocates for their health. We do this through focused seminars like today's presentation, as well as curriculum-based classes and publications. Our programming and our publications are completely free. If you're interested in learning a little bit more about who we are or looking into ordering some of our publications, you can visit our website, thewomensfund.org, and you can find a publication request form, or you can also download free PDF versions. Today, we are very excited to kick off our mental health awareness series with Carmen Martinez from NAMI, and she will be giving a presentation over Mental Health 101. So just to introduce you to Carmen, she is a graduate of the University of Houston with a concentration in business management and marketing. In 2003, Carmen was introduced to Latrice Bell while attending North Harris Community College. Over the years, the two developed an unbreakable friendship. In 2011, Latrice died due to suicide after her battle with bipolar disorder. After her best friend's passing, Carmen found NAMI Greater Houston and started dedicating her time as a volunteer, later becoming a family-to-family teacher facilitator for the Latinx community. Today, Ms. Martinez has joined NAMI as Director of Development, creating community outreach events and campaigns, and continues as an advocate on suicide prevention by sharing the story of her bond with Latrice and providing education and support for women with similar experiences. In her spare time, Carmen enjoys modeling, acting, and has competed in local and national bodybuilding shows. She is a caregiver to her mother and enjoys spending time with close friends and traveling. So Carmen, we are so grateful to have you here today. We are definitely looking forward to your presentation. I'm going to go ahead and allow you to share your screen, and I will turn the floor over.
Thank you, everyone. Happy, what's today, Wednesday. Thank you for having me. I put this presentation together, much needed conversation on mental health, and we're gonna keep it kind of simple. I definitely want you guys to ask anything on the chat while we do these presentations and kind of get some feedback from you guys. But I'm Carmen, I'm Director of Development here at NAMI Greater Houston. And NAMI is the National Alliance on Mental Illness, is the largest nationally grassroots organization, non-for-profit. We have about 600 NAMI state organizations and affiliates across the country. This just gives you kind of a good picture of where NAMI is. We're all over. We provide free support and educational programs. Our mission of NAMI is very simple. We provide advocacy, we provide education, and we provide support completely free. I found NAMI at a health fair after the passing of my best friend, and when she was diagnosed with the mental illness condition, I was kind of uneducated. I didn't know who to turn to, and suicide was never even a topic that I could even think of in my lifetime. So when that happened, I was very shocked, and I told myself I definitely don't want anyone to go through this experience. And I want to just help. How can I help my community? How can I help my friends? How can I help people that are in need? The mission of NAMI is that we envision a healing community where all persons that are affected with mental illness can just experience resiliency on a road to wellness. As I mentioned, NAMI Greater Houston is a 501c3. We were actually established back in 1988, and it was basically a group of family members, caring family members of those living with a loved one, their child that was dealing with a treatable mental illness. And, we kind of put all that together, and here we are. It's been a long time coming. We are kind of the powerful voice when it comes to mental health community. But I also kind of want to address, there's different types of mental illnesses, and there's different types of conditions, and not everything is going to be associated with a diagnosis, right? So just like I mentioned, we provide education is number one. I realized when I lost my best friend, Myself, I suffered from kind of anxiety when she was diagnosed, that I didn't know what to say. I didn't know what were the right words. And I was literally walking around in pins and needles because I had no clue. The advocacy part came after, and then I realized that there's support. I joined NAMI as a volunteer, and then I started taking a lot of their classes that they give completely free to the community. And I'll share with those later in the presentation. And then it became more of an awareness component. Not only are we the largest national, but there's a lot of people that don't even know who we are. And so the great thing is, for today is Mental Health Awareness Month. So the month of May really just brings kind of a very good awareness component to everyone in the community, and to let everyone know that it's okay to talk about mental health. I wanted to show you guys some of the graphics if you guys are not aware, that May is Mental Health Awareness Month. And then it's the green ribbon. The green ribbon represents breaking the stigma. You'll see a lot of green kind of all over in this month. And that's just kind of like our highlight color when it comes to mental health awareness. So we definitely want to fight that stigma when it comes to the education. And that's why education NAMI provides completely free. It's very essential. So let's talk about mental health, right? I feel like sometimes we think of mental health and mental illness and they're kind of used the same, but they're completely two different terms. So I wanted to kind of just go over that first. Our mental health is, everyone has mental health. Everyone is needed to have a good, positive mental health. And it's our emotional, our psychological, our social well-being. How do we think? How do we feel? How do we react? If we're under stress, how do we react our emotions? How do we communicate that? How do we handle problems? How do we handle decisions? And so we want to make sure that our mental health is always aligned and it's always healthy. We are going to have some moments that are going to give us some life struggles that we just need to learn how to balance that. And then you have those mental illnesses. Now, this is when someone is diagnosed with a mental disorder. The disorder itself, which is a brain illness, it's affecting your condition and how you think, how you feel, and your behavior. So sometimes we might not even be clinically diagnosed, but for example, when the pandemic hit last year, a lot of people lost their job. I was one of I came from a different industry before I was staffed by NAMI in November. And there was a time during the summer that I'm like, what do I do? Where do I go? What's my next step? This is an industry that I was in for 15 years, and I didn't know what was my next kind of stepping stone. It did create a lot of anxiety. A lot of people lost their jobs. A lot of people were unemployed. So that in itself, you might not be diagnosed with a mental illness, but you're going through these life struggles. I had a lot of family and friends that were going through divorce. Divorce is very tough on a lot of people. It's like death. It's the most draining emotions that you can go through. So I definitely want to kind of mention that NAMI recognizes that other organizations have drawn the distinctions between mental health conditions as opposed to mental illness. So we kind of use those terms interchangeably. So if you guys have any questions about that, I definitely want to wanted to bring that to the point, because that's where the stigma comes. When people think of like, oh, it's Mental Health Awareness Month, people already think of a negative part of it versus a positive part of it. And mental health is for all, and we all need it. The next slide is some statistics. It's very important to really kind of put mental illness, or a group of people that are affected by mental illness. But across the nation, the statistics are real. We have 1 in 5 US adults that experience mental illness, and then 1 in 20 adults that experience a serious mental illness. So you're talking about schizophrenia, you're talking about very serious illnesses that need long-term care. And then we got to talk about our youth. Our youth between 6 to 17 years experience a mental health disorder, 17% of our youth. I think the pandemic has brought a lot of isolation for people, a lot of anxiety, a lot of unknown. So we want to kind of make sure that we provide that support. Our NAMI hashtag is "You're Not Alone." Even though we feel alone, this hashtag is a recognition of, when you seek help and when you seek support, as alone as you may feel, you're not alone, because there's always a resource out there. And that's something that NAMI kind of provides. We want people to feel inspired. We want people to know that recovery is possible. We want people to feel loved. And that's one of the main things that people do not kind of reach out because they do feel alone. I felt alone. I know exactly what this message is. When my friend was diagnosed, how do I help her as a friend? When you're dealing with your own kind of, life struggles, most people don't reach out because they feel like they don't want to be stigmatized. They don't want, you always hear people say, oh, I didn't want to bother anyone. I don't want to, you know, say my problems to someone, but we all need it. We all go through that. So it's a normal conversation to have. The next thing is the warning signs, right? So my experience with this is a little bit different because I wasn't educated enough on warning signs. And we'll talk about kind of emotions and behaviors that, whether you're diagnosed with the condition or just your overall mental health, we all go through that. We feel very sad. We draw for 2 weeks. If you have someone in your family or a close friend that you start seeing those warning signs, please take them um for what they are and pay attention, because they literally can save lives once you kind of know how to react. Each condition though is different. Even though someone might be diagnosed with a mental health disorder, everybody acts differently. So the main thing is kind of just recognizing these warning signs. Um, it was very hard for me to talk about suicide. I think I literally would break down when I would mention the word suicide. You see a lot of the news nowadays of young kids committing suicides, of young adults committing suicide, and it's very alarming. And you always think when you hear these things and these topics that's not going to happen to you. I'm very well aware now when I hear these situations, and as I become an advocate on these topics, I get a lot of people that reach out to me, even in private. And I'm always very thankful and grateful, because this is where the conversation goes. What happens, right? Significant weight loss or gain. A lot of people struggle with their weight. That's just something, as women, we always kind of judge ourselves and are very hard on ourselves. You might not be diagnosed with a mental illness, but that can create a lot of anxiety and a lot of just inner depression. So you want to kind of be paying attention to kind of overall soothe your mental health. Intense worries or fears. There's a lot of things now, or people that are still experiencing worries. We still have a lot of people that are unemployed. We still have people that are losing their homes. The Texas winter was unexpected back in February. We're still dealing with people that are dealing with damages with that. So this is just a good overview of just warning signs in general, whether it's just mental illness conditions or just your overall kind of mental health. I wanted to put this slide because I found this quote from a doctor, Dr. Christopher Palmer. And the thing when it comes to mental health disorders is that none of them define the entire person. And this is very true. Although their symptoms might be, one second. Although their symptoms might be impaired, their ability to do other things, they're still able to. So whenever we talk about our health versus like an illness, it's always important to remember this. A lot of us kind of put each other in a box of, this is what illness should look like, or this is what a healthy um, mindset might look like, but we're all different. So it really goes back into the education. So we really have to learn how to put mental health priority first when it comes to our active lifestyle. Now, this is another thing because we are in a mental health crisis. Not only the stigma, in different cultural kind of demographics, a lot of people are literally speak up on getting help. And why should we be scared of speaking up, right? Discrimination, people feel like if they do speak up, they're going to put you in a box, they're going to label you. That's a very awful feeling. So the more that we become kind of shed a positive light on just mental wellness, it's all a journey. Whether someone that's diagnosed with a mental illness, you're still in recovery. People live normal lives, and it's good because they learn how to manage it. Just like we manage if we are diabetic, we need to watch our food, we need to watch our sugar intake. It's the same thing with these brain illnesses or any type of mental health condition. These are manageable conditions. These are treatable conditions. So we always want to make sure that we shouldn't have a negative attitude when it comes to mental health and mental illnesses. I wanted to kind of share this with everyone because I think it's very important to kind of realize, where is mental health in Houston? What are some of those statistics? And When I joined NAMI, that was one of the first things that I wanted to kind of learn. What is our city about? We're very resilient when it comes to just Houstonians in general. We're very compassionate. We're very helpful. But these statistics are very alarming, and I wanted to kind of share this with you. So on this slide, the very first thing is in Harris County, residents aged 30 to 40 are more likely to have reported 5 or more days of poor mental health in the last 30 days than young adults. Um, I mean, this is a big bracket here, and it almost just highlights going back into not being able to get those resources or not speaking out. Mental health disorders can lead to suicide. I mean, suicide is the 10th leading cause of death in the US, which is very unfortunate, but it's also a realistic topic. We have American young adults that are aged 10 to 24 and 25 to 44 that are dying from suicide, that are completing suicide. So I think the more that we become aware on recognizing those signs and getting help, we're hoping that one day we kind of lower these statistics. On this slide right here, I wanted to kind of highlight, we have 3 counties. In the 3 counties, 1 in 10 adults report experiencing 14 or more days of that poor mental health back in 2018, and those rates have been increasing. But when I found these statistics that were very shocking to me, is this one right here. More Houstonians suffer from mental illnesses than cancer, diabetes, and heart disease combined. You always hear a lot of, awareness on these important topics. But when you start thinking about it, that more Houstonians suffer from mental illness more than these diseases combined, it's very alarming. Houston loses about $6.7 billion a year in productivity. So these are people that are left untreated with mental illness, whether it's in a job, their prospective labor force. And it's something that hopefully with the right treatment, these numbers will change. And then mental health conditions are the leading cause of disability in Greater Houston. Um, Overall, it's very hard to get the right help, but there is help out there. Texas is number 3 when it needs for services, but it's 50. It's almost the last when it comes to funding to get access to services when it comes to mental health providers. So that's something that's kind of shocking to me when I was studying what these statistics were for our city. And I wanted to just share with you what we provide, right? We have thousands of affiliates across the country. We have our Texas organization. We have all of affiliates here. Greater Houston is one of them. We have it in Austin. We have it in Central Texas. We have it in Dallas. So across the country, thousands of trained NAMI volunteers. They're all peer-led. These are all volunteers that take their time and just for the cause support NAMI Greater Houston. We provide a lot of variety of support. We go into different community settings, whether it's from churches to schools to clinics to help all types of individuals. I wanted to kind of showcase this because I think it's very important. NAMI Basics is a class that's for parents and guardians. There's a lot of parents out there. There's a lot of loved ones out there that, don't know how to take care of their child, or in the sense that they notice something different with their child. So NAMI Basics is a free class for age 22 or younger. So anybody, parent and their guardian and the child can actually attend this class. And this is a good NAMI basic class that teaches you the basics, how to recognize the symptoms. We also have this in Spanish. What is it that you can do? Who do you turn to? How to be a better caregiver, how to kind of project your self-care and mental health. So that's what NAMI Basics is about. We also have NAMI Family to Family. This is the class that I took after my friend's passing. And I wish I would have known that this was, out there and that existed, because Family to Family is for family members, for anyone that's in the family that's dealing with a loved one within their family that's diagnosed. It could be friends that can feel supported, anything that's uncles, aunts. When I took the class, it was only 10 people in the class, and I remember every one of them. And this was after my friend's passing, and I literally just wanted to sit there and learn. So Family to Family is probably the most taken because it involves pretty much a lot of family members. A lot of our classes right now are virtual. And we were able to reach a mass, kind of demographic and just community all around Texas for the pandemic. And these classes can be taken anywhere. You might have a family member that lives somewhere else in another city or another part of, a different state. All these are virtual now. So I think it's just bringing the community together as we kind of share these virtual components. NAMI Homefront is basically something that's given with NAMI National. That's not something that we provide here locally at NAMI Greater Houston, but it is something that NAMI organization provides. This is strictly a class for family and caregivers and friends for all military service members and veterans that, when they come back from being, stationed somewhere else, or they come back with some dramatic experiences and it affects their mental health condition. This is NAMI Homefront that really tells you, how can I help my loved one? How can families help understand those challenges and improve their ability to support, the service veterans, and especially service members and veterans that are coming back. So this is something that's very near. I think they just had one last month. And these kind of, if you go to NAMI.org, they're always there that you have to pre-register for these classes. And then the last two are NAMI peer-to-peer. So this is exactly for adults that are living with a mental health condition. Whether you're diagnosed or you're not diagnosed, you might have some challenges, but these are peer-to-peer individuals. All these are private classes where you can just kind of learn from others and kind of, connect together as a community. The peer-to-peer, they meet at a certain time every week at different locations all across Houston. And it's also available in Spanish. In Spanish, it's called de persona a persona. The last one is NAMI Providers, which I think this is a great, great kind of class for mental health professionals. If we have people here that are mental health professionals, we actually have a program that's designated just for clinicians, just for mental health professionals, so they can understand and have compassion and really kind of learn what these families are experiencing and really promote a collaboration of the right model of care. So these are all at no cost that's being provided. So you have to register in order to get these classes. So taking care of yourself, we always hear that, and it sounds easy to do, right? But we, as caregivers, I take care of my mother. She lives with me, and it's very challenging sometimes to be able to not, put myself first because I'm worried about taking care of her. But we always have to put ourselves first. As easy as that may sound, most people don't do it. You can't take care of a loved one. You can't take care of anybody if you're not taking care of yourself. So that's a very goal of NAMI. We really promote self-care. We really promote kind of that emotional and physical balance. We need to know how to handle different challenges in different situations. We're all going to have our ups and downs, but it's basically, how do I improve myself and my own relationship for myself to be able to maintain these physical and mental habits? And we're going to go into kind of strategizing and kind of personalizing some things that you can do. So before we even take care of ourselves, we have to recognize what these stresses are, right? So a lot of people always kind of omit kind of the physical reactions that you're going if you're kind of running down your body. These are common physical signs of stress, and a lot of people kind of push it to the side because we're always in this go, go, go mentality. So you have to really understand how stress affects you. When you start having low energy, when you're eating too fast and you have an upset stomach, or you have constipation or nausea, these are things that are your body's telling you to slow it down. Any types of aching pains, I know, I'm always on the go and working really hard, and I start getting pain in my shoulder or my neck, or I don't get headaches, but I know a lot of people that get headaches. Insomnia is another thing that hits me directly. My mother suffers from insomnia, and I just kind of starting I started having those effects last year during pandemic, and I think it's because of everything that was going on, and I literally would just stay up. Your body's like, okay, I'm up. I can't go to sleep. So these are just identifications of how stress is creeping up. So you have to kind of pay attention and be aware. Some of these things might go away within a week or two, but if you see them constantly coming back, the same thing with your child. If we have parents that start noticing your child's behavior, how do they manage stress, and talk to them. So it's better for us to kind of understand and cope with recognizing those symptoms, and then we can go and react. All right, so now we can go back into the self care. Physical health is priority. That's one thing that I have learned. If we don't take care of our physical health, our mental health is just not going to be right. And a lot of people kind of omit this. I think the pandemic brought a lot of people outdoors after isolation. Being indoors really kind of created anxiety. But now we can walk outside. We can walk around in your neighborhood. So you have to kind of maintain these good mental habits. You have to keep your body strong because that's the foundation of everything. If your body starts falling apart, everything else internally, mentally will start kind of falling apart as well. Exercise daily. I know this sounds super easy to do, but most people don't do it. Even 20 minutes, if you exercise even 20 minutes a day. Um, I know a lot of people are working from home. So the days that I'm at home, I literally take a little break and I time myself. I'm like, hey, I'm very, very busy, but let me give myself time. We have to kind of schedule those times within ourselves. Daily exercise reduces stress. It produces the stress relief hormones that your body needs. So even if it's 10, 20 minutes, just take a break. Anything that you're doing can come back. Like, my brother is a big, not a good person that protects his physical health. And he's like, I'm so busy, I don't have time. You always hear people say, I don't have time. You have to make time. And that's something I would come home from work and bring all my work and bring it from the office and say, I'll work on it at home on the weekends. When I started doing a lot of work with NAMI in the beginning, that's what I was going home and bringing a lot of that work because I was a new employee and I wanted to kind of make sure I get everything right. But then I realized I'm not giving myself time. So I stopped doing that. And at first I was like, oh man, it's just going to pile up even more on Monday. But then as I trained myself in my mind and I started using those free times to improve my physical health during those weekends activities, biking became, something that I love to do now. So just remember you have to exercise daily and give yourself make time and put that in your agenda if you're agenda driven. Eat well is another part. Sometimes we're so busy and we have a lot of unprocessed foods. You have to kind of implement healthy habits, more grains, more vegetables, more fresh fruits. I know we hear this from our doctors all the time, but a lot of people don't do that. There's a big correlation with not eating right with affecting your gut. Your gut and your stomach is the first thing that gets affected. If your gut and your stomach is not right with, the right ingredients and the right food, everything else starts falling apart. Sleep is the other thing. I can easily say I'm a big napper. I love to nap. I try to get in when I can. And people are like, if you take a nap, I would just stay up all night. But I realize when I do need it and my body's telling me, hey, take a break, 10, 15 minutes, I say, Siri, set the alarm for 20-minute nap. And I kind of listen to my body and it goes back into what I was saying. Let's make sure that you listen to those warning signs. Your body will always tell you what you need to do and slow it down. Avoid any alcohol and drugs. They definitely do not reduce any stress. It'll make it a lot worse. And then practice relaxation exercises. My mind is kind of all over the place in the mind that I'm always go, go, go. So relaxing for me, I found other physical activities to relax and meditate. A lot of people meditate. I started doing breathing exercises at night. There's an app called Calm. You guys probably have heard it, but it really helps you slow down. So practice those relaxation exercise. Take 5 minutes before your day to really kind of breathe, and before you go to bed, turn everything off and really kind of relax. Even if it's 5 minutes, or even if you don't do it, if you feel like 5 minutes is too long, start with 1 minute, then 2 minutes, and kind of lead into that. It will really help you with your physical health. And now I want to talk about depression because a lot of people, you always kind of hear people say, "Oh, I'm depressed." There's a big difference between being depressed. Everybody gets depressed at some point with whatever life challenges, and then clinical depression and seasonal depression, which are more diagnosed. So symptoms of the depression is feeling hopeless, crying spells, apparently for no reason, problem sleeping, unintentional unintentional weight gain or loss. And then the loss of your kind of motivation. I think the pandemic has brought a lot of loss of motivation for a lot of people. So these are just kind of the same things you have to recognize for these symptoms. But then, what's been happening? We do get to that point of burnout. You're literally exhausted. We have a lot of parents that call our office and they're burned out because they've been trying to manage a full-time job and now they have their kids and now they're teaching them through Zoom and they can manage all these new changes that's happening. And you have every right to feel emotionally and physically exhausted when things kind of change. Emotional stress can lead to a lot of just burnout. You just want to just give up. Um, so when you do feel burned out, go back, step away, recognize those symptoms, and really acknowledge that it's okay to say, you know what, I've overworked myself. I stopped taking things in my agenda that I can't handle. And sometimes as women, we try to say, it's hard for us to say no. We feel like we always want to say yes. Um, and it's okay. I started doing that myself and I'm like, I'm sorry, I can't get with you right now. Or if I'm being asked for an extra task and I already have a plate full of stuff, I just said, I promise I'll circle back. It's just not the right time. And I really started implementing that recently. And I feel good now because before I would just always want to kind of please everyone because I just, if someone reached out, and sometimes it's just not the good time. It's remember yourself, mental health is always first. And I wanted to just kind of share this why mental health matters. Mental health treatment, whether it's therapy, medication, self care, we have made recovery a reality for most people that are experiencing mental illness or just your mental health. But in average, it takes about 11 years between symptoms onset and treatment, which is a high number. Sometimes, if you don't start taking care of these things right now, you might go on years and years before you really realize that you need to go get help. People that get treatment in a given year, 45% of adults with mental illness, 66% of adults with serious mental illness, and then 51% of that youth. And I covered those statistics earlier. But let's look at the adults with mental health diagnosis. It kind of shows you the breakdown there. We have 50% of white adults that receive treatment and counseling. So that just tells you that particular demographic is open for that. But then you look at Hispanics, you look at Blacks, and you look at Asians, that percentage is dropping because of the cultural stigma that is behind seeking help or asking for help. We really want to change that mindset and kind of change those statistics. The more people talk about it and normalize just your overall mental health or a condition that you need help with, the better it's going to be in the future. A lot of people always talk about therapy, right? I'll share something with you guys. I went through like a bad breakup. I don't know, 2017. I was dating someone for a year and you know, and then it was not it was not there anymore. And it really brought me to therapy because I was emotionally invested in this relationship. Now looking back, I probably would have been like, why did I even bother with not recognizing putting myself first? But a lot of people go through that. I talked about people that go through divorce, people that um, dating relationships can cause a lot of stress. And it might lead you to therapy. And therapy is awesome. I recommend if you find the right therapist to cope with your feelings, to really just understand your behavior. They're there to guide you. I mean, we go to the doctor when we're sick, if we have the flu, if we have a cold, if we have a migraine headache. So why not go and get therapy with a professional when it comes to your mental health? And I wanted to just kind of break down psychologists. A lot of people think of therapy as like a negative thing, like, oh, you're going to a psychologist. But psychologists hold a doctoral degree in clinical psychology and in other specialties when it comes to counseling and education. And they really treat you and really kind of help you. So you might not really need a psychologist. You might just need a therapist. It could be a family therapist. You might have issues or a struggle with family members, and you want to kind of resolve that. There's therapy for couples. There's therapy for parents and children. So just don't be afraid to seek help and ask for help. What I do recommend is for you guys to find the right therapist. You have to kind of bond, just like you bond with your doctor. You have to find the right individual that you feel connected, and you won't know that the first time. It'll probably take two or three times. And then you'll know, okay, I'm able to open up. So I highly encourage, if you need to go that route to take care of your mental health, you don't have to be diagnosed with anything. I went through a breakup, and that's how I dealt with other things. And then through the therapy, I was learning other things about myself. And then it became less about that, relationship, and more on my family and other things that I needed to do to understand myself. So we're back to the self-care. I really like this slide because if you look at the brain and all the colors, if we don't do all these things, our self-care falls apart. We gotta get some support. We gotta get the right food. We gotta get the physical activity. We gotta recognize the symptoms. So this is kind of a good picture that I always like to share, because you need a little bit of everything to be able to be whole with your self-care. I know I sound like a broken record, but it is very, very hard when people don't do this. Get good rest, exercise, eat healthy, but you have to connect, right? Sometimes now that we've been in isolation, as the world is opening back up slowly, connect with individuals, talk on the phone, do FaceTime. I think one thing that I really enjoyed about when the world was shut down last year is that we connected with individuals through virtual connection, and saw each other, and we connected in another way. And that was very, very helpful. Um, any type of support, get some coffee, meet some friends, even if it's virtual right now, it's okay as long as you have that connection. Meditate, mindfulness, meditation, whatever that may be for a lot of people. And the last thing is you have to know your limits. You have to decline requests. That's something that I have learned. I used to never say no. I used to take everything because we're super women, right? We're supposed to do everything on our own. But it's okay to set your limits. Sorry, doesn't work for me right now, but maybe another time. Keep it short, keep it simple, and stick to self-care for you is always first. And now I kind of wanted to transition to a very important day for us. It's our annual NAMI walks. So NAMI started this walk, it would be 16 years ago here in Houston. We wanted to dedicate a day where we brought the community together and kind of just rejoice about positive mental wellness, rejoice about bringing the community together, recognizing those family and friends that may have a loved one that's diagnosed. So we have our annual NAMI walks. This year is Saturday, May 22nd, which is next week. And we're doing two components. We're still keeping kind of that virtual participation, and virtually just means if you're out and about, if on that day or before, if you want to do some type of activity, whether it's cooking, whether it's walking, whether it's riding your bike, just connect with us, and kind of highlight this special day on, it's called United Day of Hope, on mental health awareness. So that's kind of virtually. And then we're also selecting 7 parks around Houston where you can join us. Anybody that feels like, hey, I feel comfortable following our safety protocols. If you want to meet us, we have Levy Park, Memorial Park, we have Bayou Park, we have a park in Cinco Ranch and Katy in the Woodlands. And so this will be a day of celebration for everyone. These are examples of what we're going to do on these, bringing the community together, is providing signs of hope, right? We all need hope. We all kind of have our own story. And we walk because we want to promote awareness and break the stigma. We want to promote healthy mental health habits. We want to reduce the stigma. We want to kind of find fundings, because this is a fundraising walk. It's been going on for 16 years. All those resources on all those educational classes that we provide is completely free to the community. And this is why we walk, because we want to continue giving these support and resources to Harris County, Montgomery, and Fort Bend. We also have some branded t-shirts. If you look at those t-shirts, we are going to be able to wear that on that day. If you raise $100, you automatically get the t-shirts. And this is a way for you to connect virtually. We have these signs that you can join us, different activities to be able to participate and just give highlights on such an important month. Saturday, May 22nd, completely free to register, and it's our United Day of Hope. And that's it. That is all I had.
Well, thank you so much for that wonderful presentation. We're going to go ahead and open up the floor for questions at this time. I see that we do have one question in the chat, so I'll ask that one first. The question is, can an individual get assistance from NAMI when they have a family member they're concerned about and they don't know where to turn? An elderly friend is concerned about an adult son who has extreme OCD and she has run into dead ends when seeking guidance.
Absolutely. So that's what we're here for. NAMI has a resource line. It's open from Monday through Friday. I think it's from 9 to 4. And I'll put the number in the chat. You can call our resource line and they can guide you. We get up to 500 calls a week of people. Where do I go? What do I do? Where do I get support? And so that's what NAMI provides. Our C Center line is 713-970-4483. We also have a Spanish line, but we definitely connect you and provide you with the right resources. So that's an excellent question. That's something that we want to continue. And sometimes we get calls where people just want to, they have nowhere to turn to, and we have amazing volunteers that have been part of that for many years. If you're going through a stressor, if you're going through anything that deals with a struggle, please call our C Center. And C Center stands for Support, Education, and Advocacy. If you just go to NAMI Greater Houston, it'll have more information there, but the number is 713-970-4483.
Okay. So she said, many thanks. Could you repeat the number? And I'll go ahead and
Yeah.
type it in the chat as you.
Oh, I just typed it.
Okay,
I just
awesome.
typed it.
Awesome. Okay, so I'm gonna leave my chat open in case anyone else has any questions. Feel free to pop those in there. But a question that I have for you, the first one is, what are other ways that we can help someone that maybe doesn't want to seek professional help?
That is a tough one. And the simple answer for that is you can't. That's one of the things when I took the family class and I became a teacher, and when I was learning, is it goes back to that self-care. There's a lot of situations that you're in where you're wanting to help someone. You understand that they just don't want to, or they don't recognize that there's nothing wrong with me. I don't need any help. As much as you can try, there's different ways, whether it's, finding them a right therapist, or there's some people that don't have insurance. Therapy is not covered for a lot. Where do you go get help? NAMI will be able to provide where to go, these free resources. We have a lot of relationships with hospitals or clinics or the Harris Center. That's the building that we work on. Within the Harris Center, there's a lot of resources there, clinicians, therapists within that building. But sometimes, as much as you can, and they still don't want to. I had a friend that called me frantically by text. Actually, she didn't call, she texted me late at night. And she said, I have a friend that I'm trying to help. She's diagnosed with bipolar disorder. She got off her medication and now she's about to be homeless and be on the street. We're trying to help her. What can I do? So I refer her to a resource line for be able to get any type of sheltering, if that's something that, that's a very dramatic where you get to that point. But I had to tell her, just like I'm telling you, sometimes people don't want to get help and there's nothing you can do until that individual says there's something wrong, help me. Now you can continue kind of advocating and kind of get that support. So the way that you approach it is, I care for you, I understand you. I might not be there with what you're feeling, but I'm there for you. When you're ready to get help, I will be there. So the main thing that I've learned here with NAMI Greater Houston is that sense of community and that sense of unity and feeling supported. That's why our hashtag is "You're Not Alone." A lot of people feel alone, and sometimes it takes time. I guarantee you, there's a lot of people that don't want to get help, and you're seeing them, whether it's a friend, whether it's a family member, whether it's the child or friend of one of your friends, right, or a coworker, and you see them spiraling and going down, and all you want to do is, as women, we're like caregivers and we want to help, and you're like, just listen to me, but they don't. So it's very hard. I can just speak on that because my niece, she just turned 26 last year. My sister called me frantically one night. Can you come over? Something's wrong with Julie's her name, right? And I go there, and we really had to put her in a psychiatric clinic for 5 days because she was battling depression, and she didn't know about it. After she got out, I told her to go take the family to family NAMI classes to help her. Um, and then after, it was like, you have to recognize when someone's clinically diagnosed, they're not the same individual. So you have to continue that support, and you have to kind of continue kind of monitoring what's going on, because a lot of things can change. And I think when, when you're not diagnosed and you're just helping someone, they're going through a rough time, you have to just stand back a little bit. And my sister was in denial. There's nothing wrong with her. I don't need to take that class. And I'm like, yes, you do. Because these classes teach you everything. They're wonderful. They used to be 12 weeks long. Now they're only like 6 weeks, I think. And it's all virtual, super easy. And they're private. They're all virtual. But the classes really, they break it down in each week. So the first is kind of introduction to like mental health 101. The second one can be like brain illnesses or disorders and kind of understanding. The second week could be medication. The fourth week is completely about how do you communicate with the questions that you're telling me. What do I say? How do I communicate? One of the chapters is about someone going to jail. Someone might have a meltdown or a breakdown and they're psychotic or they're not psychotic. And who do I reach out to? And people always dial 911. That's one thing that we have. I'll send you the mental health crisis for the Harris Center. And sometimes it's just, you're in a crisis that someone might just be stressed out and burned out and lash out. So these are things that we always tell people. If unless it's a life-threatening situation that you need to call, your life is in danger, yes, you do call 911. But other than that, we try to tell you that's not the right solution. And sometimes you just have to step back and hope for the best. And that's very hard to say, but that's the way these classes are broken down. And it helps you understand a little bit better.
Yeah, I'm really glad that you spoke a little bit more about the classes, because I think, maybe for people who have never had some of these mental illnesses or these conditions, it can be hard because they may
Hmm.
be feeling like I'm just trying to help and this person is pushing back, because maybe they don't really understand. And so I think the classes are really great. And I love that they offer them for people who are family or who are friends, as well, and not just people who maybe suffer from a mental illness or condition.
Exactly. And remember, we also offer educational programs and classes to teachers and to parents and to children. Under 22, we have a specifically program just for that. So peer to peer are people, individuals that are diagnosed and that are in recovery and that just want to kind of, they kind of go in and out of these support groups. But you build a bond. And then clinicians come to us. Even though they're trained mental health professionals, we teach them a class, a program on how to be more, have more empathy, how to understand their patient, what they're feeling, right? They're coming at it in that medical kind of, approach. So we definitely teach everyone. And then the Homefront is an amazing program that's set with NAMI National, because we have a lot of military personnel and veterans that are out there suffering. You might know someone, you might be a friend, but these are the resources when we say at NAMI, if you reach out, then you're not alone, because these help are completely free. And it's all over. It's not just here, in Houston, in Texas. We have 600 affiliates all over the nation.
Another thing that I picked up on that you mentioned earlier that I didn't realize, but I thought was great. So whenever I was in college, because I was a student, I had access to the counseling services or mental
Hmm.
health services for free. And I got out into the real world, and that's something that I haven't come across yet. I mean, maybe it's because I haven't really looked that hard, but I know something that can get in the way of someone seeking help is finances. So I really appreciate that you mentioned, if you need assistance or you need help, reach out to us. We can give you some resources and point you in the right direction.
Yeah, and we literally have an entire database right now with partners that have been with us and any type of topics. Like, you call that number, whatever you're needing, and there's an answer for it. This morning we were actually doing an updated training with all our volunteers that have been there, amazingly kind of navigate through the system. One of the things looking back, like when my friend was diagnosed, and I remember she was having a breakdown, and we didn't understand what that was, and we called the police because I'm like, I don't know where do you go, what to do, and they handcuffed her and was literally treating her like she was a criminal. And I remember, I remember telling the police officer, why do you have to put the handcuffs so tight? Like she's having, like we didn't understand. So one of the things that I've learned now is education is such a big key. And that was something kind of a unique situation. But now that I learn and what NAMI offers, and there's other places too that offer a lot of free resources, that is when I became really passionate on, we need to let people that there's help out there. And it might not take the first time, it might take a couple of tries. But our volunteers are very great because they also are reaching out to not only our partners, but they take all the notes. When you call, they'll take all the notes of what you're looking for. They'll go and research it, and they'll communicate, and they'll send you all this information. And then we also have these care calls. So once you call us, we take note of that, and then we check in every now and then just to see how you're doing. Sometimes we hear people that call us regularly. Some people are like, I'm good. Thank you for the information, and they go on your way. But we have these care calls that we really appreciate just to check in, because sometimes, honestly, there's calls that you get and people just wanted to be heard. And you're like, all right, cool. Everything's good. One time I got a call um, from my desk, because it's a different, and I don't know how it kind of came. And it literally was that. It was about suicide. It was this mother with a teenage, I don't know if it was a son or a daughter, I can't remember. And I'm glad I got that call. I always say things happen for a reason, because I understood where she came from. I understood how scared she felt. I understood the frustration. So I kind of calmed her down and kind of gave her, in that same building, we have our suicide prevention team. It's a whole different organization. And I also kind of volunteered a little bit after my friend's passing. But after I talked to her and I calmed her down, and that was it. I was like, if you need my number, here it is. You call me at any time. And sometimes you don't have to have a clinically diagnosed mental illness. Sometimes you're just sad and depressed and need your girl time or need a friend time, and you just want to talk it out. The main thing is getting that support and seeking help.
Awesome. So the next question that I have, you spoke a little bit about fear of discrimination. Is it a good idea? This may be a more of a personal opinion type question, but is
hmm
it a good idea to tell friends, employers, or colleagues if you have been diagnosed?
I don't know on a legal component. That would be more of an HR question. But me personally, it all depends on the individual, because then it goes back into, our NAMI president put a blog a couple years ago, and I found it, that he said mental illness is not a stigma of why people want to not speak up. It's because they get discriminated. The moment you say you're having this, you're discriminated on X, Y, and Z. And it is a form of discrimination. So I would just say, in my opinion, it depends on the individuals and what makes you feel comfortable, because you have to kind of, if it's a work environment, is your condition going to affect your work performance? And you want to let someone know, right? If you're traveling, like when my friend was diagnosed, we had a trip scheduled. One of my friends was getting married in Jamaica, and it was, 50 people that were going. And I hadn't traveled with her. I didn't know how she was going to behave. And I called her, my friend that was about to get married. I'm like, look, my friend's coming with me. This is what's going on. I just want to give you a heads up in case we need to pivot to some type of crisis intervention thing. We're in Jamaica. I have no clue. And I just gave her a heads up, and it worked totally fine. And I knew who to share. So I think it's a kind of on a per case basis of what makes you feel comfortable and what you want to share.
And then you spoke about this a little bit at different points throughout the presentation, but how can we, or what are some things that we can do to help fight stigma against mental illness and mental health conditions?
Conversation. The more that you share it, the more that if you're at a gathering, if you're at a family reunion, if you're around the holidays, the more people share just kind of those feelings. I come from a Latino culture that you never speak about feelings. You're like, you're crazy, and we use these terms. Everybody uses that. Don't pay attention to your uncle. Don't pay attention to that person. They're just stupid, or whatever terms, right? Negative terms. And so you become into these creatures of habits that you kind of omit these things that might be something serious going on. Maybe someone is having a meltdown. Maybe someone's struggling with, a long-term depression, not clinically diagnosed, but they might be going through something. So my main thing is, after my friend's passing, people were reaching out and were like, "Oh my God, well, what happened? She looks so normal. Like, what was going on?" No one knew that she was even diagnosed. She was scared to death to let people know because of how she felt that she was going to be treated. So I think the more that we have these conversations, you don't have to talk about the illness part of it. You talk about the recovery, you talk about being supported, you talk about, day-to-day living, and these are treatable conditions. The more that you talk about them, the more that you get support. I share on my personal social media all the time. I put a little bit of everything. And then people reach out to me, and it becomes just like a more common conversation, and more natural. Like, it's okay. We talk about losing weight and issues we have with either gaining or losing weight. We talk about heart disease. We talk about cancer. We talk about breast cancer, and how do you do to prevent it. It's the same thing with having mental health conditions or those topics. You just act like it's no big deal. You're just getting help.
Thank you. And then the last question that I have for you, and I've been doing this for a while now and I really like it, is if you could leave us with one last final piece of advice, or what is the one thing that you want us to take away from this presentation?
I actually have a tattoo on my shoulder, which is a Bible scripture, and it's the "Fear not, for I am with you." And really, just don't be fearful. The moment you step out of that box, whether you have faith in a spiritual connection, whatever that may be, just don't have fear. Just seek help. Just reach out. So I would just let people understand and let people know that it's okay not to be okay. It's okay for not to be perfect. We all have those moments. This isn't something that just affects a certain type of, people of color, or a certain demographic, or a certain age group. This affects everybody. Children, pay attention to children's behavior, pay attention to your loved ones. Young adults are going through a lot right now. Even elderly. I forgot to mention this. We forget about our elderly. Like, they suffer too. Grandparents suffer too. So just kind of don't be fearful of judgment. Don't be fearful of seeking help, and just be you and be true to yourself. If something's bothering you, speak up, however it is, and research and educate yourself. And I think that's going to change a lot of mindsets.
Well, thank you so much for joining us today. We really appreciate your presentation. It was awesome and very helpful. If
Isabel, did you
anyone,
have a question? I think she had raised her hand. I saw the little hand emoji.
Yes, actually, I just want to thank you, Carmen, and thank you to the Women's Fund, because this is great information. And everything that you say, it's true. I mean, we believe that we're okay. We don't need any help.
Of course.
And you're right. All of us, we're going through something. It's very challenging for our youth right now, because of the way they've been, well, all of us actually. But I got really surprised one time that one of my friends mentioned that her son wanted to commit suicide just because they took the stereo out of his room. And I was like, okay, it was not even the phone, it was just a stereo. So that
Yeah.
was a really shocking moment for me of how they're thinking right now, how little things like that are
stressors.
affecting the way.
Yeah.
Yeah. So thank you so much for the information. Definitely, I'm with Harmony Public Schools, and you're gonna hear from us.
Yeah, absolutely. And one thing, before we wrap up, just 30 seconds of your time, pay attention to when they say that. My friend actually said those things, and we were like, there's no way, like, that's not an option. And I think nowadays, and that's one thing that I have learned, and people reach out to me, you have to ask, have you thought about hurting yourself? not at that moment, but in a moment where you see that person, you know, maybe they said something, and you know, and just kind of put it in the back of your mind, just like learning those symptoms, and ask them, have you ever contemplated hurting yourself? That's it. If you have, know that I'm here for you. And I can send you guys like just kind of what questions to ask. Because before we come, especially with suicide, you think of, I mean, now a lot of people are feeling hopeless, but you have
Yeah.
to know how to approach it and ask the right questions. And if you ask the right questions, trust me, you're making a big difference versus not talking about it. And then it happens and you're like, what happened here? A lot of people will give you those signs and will give you those stressors, and you have to just know how to approach it the right way.
Yes, and you said something also that is correct, especially in our culture, because in sometimes the Hispanics we go like, oh no, we don't believe in depression. That doesn't exist. We have been going through so much stuff, and it's a lot, a lot. So thank you so much for the education and the time you're spending with us.
Yeah,
So hopefully we
absolutely.
can hopefully we can be part on Saturday for the
Yeah. If you guys go to NamiWalks.org, and I'll send you that. It's just NamiWalks.org/Greater Houston. All the information is there. But just to answer of like how we can normalize that conversation, a lot of things are happening, amazing things on TikTok and on Instagram right now with people making fun of the Latino culture. I followed this Hip Latina. They have thousands of followers on that page. And it talked about that, Isabel. The other day, they put a funny video, almost like a TikTok video of like what your parents think of mental health and what you think. And it was just kind of very comical. And I think the more people have these conversations are open up there, because it's a cultural connection too.
Well, thank you so much, Carmen. Thank you.
Thank you, everyone.
Yes, thank you all so much for your participation and for this wonderful presentation. If you do walk away with questions, or maybe you think of something later on, you can always reach out to us at healtheducator@thewomensfund.org. I've also included a survey link here. I'm going to put this in the follow-up email along with some of the resources that Carmen talked about. And so the follow-up email will be coming either later today or tomorrow with those resources and the link to our survey. And then upcoming presentations that we have. So this is Mental Health Awareness Month, so we're going to focus our presentations on mental health. We have a presentation on stress and coping later this evening. We have a presentation over anxiety and mood disorders on the 17th. We have a presentation over depression and stress. That is our second awareness series presentation next Wednesday. And then we have repeats of stress and coping and anxiety and mood disorders. And then I believe on the 26th, we have a self-care presentation as well. So if you're interested in any of these presentations, please register on our website. If not, I want to thank you all again for being here this afternoon, and I hope you have a great rest of your day.
Thank you, everyone. Nice